your trusted source for the latest news and developments in Sierra Leone. Today, we embark on a groundbreaking journey into the arts of our nation's digital evolution. In a world where information flows seamlessly through screens and keyboards, new media has become a powerful force shaping our society and driving progress. From the energetic bloggers who bring fresh perspective to social media, influencers who amplify voices and stories, Sierra Leone's digital landscape is alive with innovation and engagement. In our new program, New Media: Contribution to Development in Sierra Leone, we explore how these digital pioneers are transforming our nation. Join us as we dive into the world of online content creators and media innovators, discovering how their efforts are fostering growth, education, and empowerment across Sierra Leone. Tune in as we spotlight the voices behind the screens, unveil the impact of new media on our development journey. This is New Media: Contribution to Development in Sierra Leone, only on Voices Online TV. Voices,
your trusted information hub.
Welcome to Voices Online TV, your trusted source for the latest news and developments in Sierra Leone. Today, we embark on a groundbreaking journey into the arts of our nation's digital evolution. In a world where information flows seamlessly through screens and keyboards, new media has become a powerful force shaping our society and driving progress. From the energetic bloggers who bring fresh perspective to social media, influencers who amplify voices and stories, Sierra Leone's digital landscape is alive with innovation and engagement. In our new program, New Media: Contribution to Development in Sierra Leone, we explore how these digital pioneers are transforming our nation. Join us as we dive into the world of online content creators and media innovators, discovering how their efforts are fostering growth, education, and empowerment across Sierra Leone. Tune in as we spotlight the voices behind the screens, unveil the impact of new media on our development journey. This is New Media: Contribution to Development in Sierra Leone, only on Voices Online TV. Voices,
your trusted information hub.
Welcome to Voices Online TV, your trusted source for the latest news and developments in Sierra Leone. Today, we embark on a groundbreaking journey into the arts of our nation's digital evolution. In a world where information flows seamlessly through screens and keyboards, new media has become a powerful force shaping our society and driving progress. From the energetic bloggers who bring fresh perspective to social media, influencers who amplify voices and stories, Sierra Leone's digital landscape is alive with innovation and engagement. In our new program, New Media: Contribution to Development in Sierra Leone, we explore how these digital pioneers are transforming our nation. Join us as we dive into the world of online content creators and media innovators, discovering how their efforts are fostering growth, education, and empowerment across Sierra Leone. Tune in as we spotlight the voices behind the screens, unveil the impact of new media on our development journey. This is New Media Contribution to Development in Sierra Leone, only on Voices Online TV. Voices,
your trusted information hub.
welcome to Voices Online TV, your trusted source for the latest news and developments in Sierra Leone. Today, we embark on a groundbreaking journey into the arts of our nation's digital evolution. In a world where information flows seamlessly through screens and keyboards, new media has become a powerful force shaping our society and driving progress. From the energetic bloggers who bring fresh perspective to social media, influencers who amplify voices and stories, Sierra Leone's digital landscape is alive with innovation and engagement. In our new program, New Media Contribution to Development in Sierra Leone, we explore how these digital pioneers are transforming our nation. Join us as we dive into the world of online content creators and media innovators, discovering how their efforts are fostering growth, education, and empowerment across Sierra Leone. Tune in as we spotlight the voices behind the screens, unveil the impact of new media on our development journey. This is New Media Contribution to Development in Sierra Leone, only on Voices Online TV. Voices,
your trusted information hub. Alright, good afternoon and welcome to the first edition of this week's program, Lunchtime Live, where they come to you live on Voices Online TV, na Facebook and we YouTube channel. The 1 hour 30 minutes program, they look at issue that we get for the development na saloon. You where they watch we and want for take part in the program, can do so by way how you go send we text message to the number 034 225-373. The number again is 034 excuse me, 225-373. Or if you're out of Salone, you can add +232. Me when they bring the program come to you this afternoon, my name na Fatima Sisi. Now the program today, we can look at hepatitis, waiting at this sick, and how person we get them, go no say you don't get them, and waiting for do for making or get them. Well, na the studio this afternoon, I dey welcome John Lamin Smith, we na the founder National Alliance Against Hepatitis Sierra Leone. And then also this afternoon for can tell we more about hepatitis and also about the organization. Good afternoon, welcome to the program.
Yeah, good afternoon.
Okay. Okay, you go here for my gist now as a pharmacist and you get plenty information for we this afternoon. But make we start the program proper with this information we come out from the National Alliance Against Hepatitis, where as yesterday, 28th July 2024, now be World Hepatitis Day, with the theme, it's time for action, test, treat, and vaccinate. And the Alliance bring this message to all people in Salone for make me know more about the sick.
Be hepatitis and we know it. Confront it. Protect yourself. Be hepatitis and we know it. Confront it. Protect yourself. We are here to raise awareness about hepatitis, 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 hepatitis in our country. World Health Organization is saying, be aware. Ministry of Health and Sanitation is saying, be aware. National Hepatitis Alliance is saying, be aware. Pharmaceutical societies alone is saying, be aware. Pharmacy Board of Sierra Leone is saying, be aware. Parliamentary Health Oversight Committee is saying, be aware. Sierra Leone Medical Dental Association is saying, be aware. Knobs and Slims of Sierra Leone, they are saying, be aware. Sierra Liver Foundation is saying, be aware.
Don't be panic. Be hepatitis aware. Be hepatitis aware. Be hepatitis aware. Every year, July 28th is World Hepatitis Day. We must be aware because hepatitis is a slowly and silent killer disease. It affects everyone at any time. 10 million people are nearly infected. 95% of people having it unaware. Less than 1% have access to treatment. Why? Oh my people.
We know it. Confront it. Protect yourself. Be hepatitis and we know it. Confront it. Protect yourself. Hepatitis and we know it. Confront it. Protect yourself. hepatitis how we are. Know it, confront, protect yourself.
All right, on behalf of Voices Online TV, we say plenty thank you to National Alliance Against Hepatitis for where them bring that message there to the public, and we hope say you whether na host the watch we or any side where you do you the watch we, you don't get the message and you need for grab now and do the needful we get for do it test, vaccine, or you prevent yourself after you don't know your status. All right, we dey continue with the program, and today we say we dey can talk about hepatitis, waiting at this sick, how it on the go, the status, and also how you for prevent yourself from Well, we get John Lamin Smith, when are the founder, National Alliance Against Hepatitis Sierra Leone, and also when a member na the Ministry of Health Task Force. Good afternoon again and welcome to the program.
Good afternoon.
All right, we dey also today for talk about hepatitis, and yesterday, July 28, 2024, na be World Hepatitis Day. First of all, you are the founder for this particular organization, where na National Alliance Against Hepatitis na Sierra Leone. Now begin for look at hepatitis. Waiting at this particular sick, what they talk about?
Good afternoon to everyone listening to me. Hepatitis is a condition where they affect a vital organ in the human body, and that organ is like a chemical factory that process most of the food, the medicines we take. It's a very, very important organ, and it is the largest organ in the body. We call the liver. So according to hepatologists, people who did studies over time, they describe hepatitis to be an infection of the liver, but mostly they use a big medical term what they call inflammation. So when they said inflammation, they mean say injury to the liver, like an insult. The liver don't get so foot. The liver in normal picture, not day again, I suppose for day. The liver not they do in work again, I suppose for doing work because of things that don't happen to them. I go later, it's like you build your house, you get fine wall, then later you see wall, they crack, they get like line. You know, they don't say something, they go wrong with time. So with regards to hepatitis, naturally, na tumbu they cause them, and it affect the liver because then virus is in about 5 types. The reservoir and the liver then they attack. Because however I get for B, something they come out from one side, go to the other side. So we have 5 types of these viruses that has been discovered. We have the hepatitis A, the B, the C, the D, and the E. So these are the 5 types. So of these 5 types, we start thinking now, how can we look at them? Do we have all of them in Sierra Leone? So this hepatitis A virus has like we're going to call incubation period. Or we guess outside something they stay for some time before it come out. Then contaminated water, environment they will not clean. Food they will not eat well. Physics because the hepatitis
okay.
now from the inside they get out.
We will come to outside or the cause. Wait till the cause. Let me go back to the how get for do with the type. You say we get 5 type.
Yeah, the
who's one in a salon?
Well, basically, based on studies so far, then it's about hepatitis B and C. We studies them from 2022. Before that, done the show say this particular type, they so much that they reach to a level. So, okay, can we know the prevalence? How many people get under the country? So, a study from 2022 show 13.8% of people will get hepatitis and 2.4% will get hepatitis C. If you break them down, that means say 1 in every 7 people in Sierra Leone. If you count 7 people, 1 person they will get viral hepatitis. So that is the cause. If you ask waiting at the type, we have the other one, a non-viral hepatitis. The non-viral now as a result of things they take, we're not to viruses there at all. Maybe the food they eat, the drinks they take. So, like for example, alcohol. Alcohol is one thing that can affect the liver. It's like an insult, harm being done to the liver as a result of something they take. So you where they drink alcohol, even though maybe they say recommended units the way person for take, but alcohol gets so much impact where it cause na the liver, so it disturb them. And then also street medicines, certain medicines, so you're not supposed to buy in a street. Because why would they say this? We look at the common things the way they now we country Sierra Leone. Nowadays, you see the inside buses, they go, you see somebody carry side, begin they advert all sort of medicine. This is wrong. We not they advise anybody for do that because some of them tell way they take, they go harm the liver. Even though it is cheap. And they say they in front of everybody, one the way they sell and then storage condition outside and put her in a good way, take an insect can inflame the liver. And then people are used for drink them, bitter medicine, bang, maybe in a village, you say you get this sick, drink this medicine. Some of them continue to call toxins. Then here also they go put pressure na the liver, so they inflame the liver. So generally that inflammation, you get stages the way they reach. So, but basically the viral hepatitis is not a concern because they come up from one person to another. If somebody don't contact the hepatitis B virus by means of maybe by lifestyle, what they do, insect can pass on. So it can then now human to human transmission among them, and that can cause a problem.
So the viral and the C.
Yeah, the viral are A, B, C, D, and E.
Wow,
the viral
we get
hepatitis.
all three.
We get 5 types. We get the A, the B, the C, and the D. These are the viral. These are mean that the hepatitis where they get as a result of virus. Even though there are other viruses where they cause them, but that's why mainly the epidemiologists, the one they study, look at and say that they why the main thing where they go to the liver and when they affect the liver, they begin present to different signs and symptoms.
So how serious this sick be?
It's serious so much that if you don't contact them, you get things the way they show up to you, where as a result, because you don't get knowledge or you're unaware, you don't know, it can lead to complication, problems later. We can most of the time lead to death. Some people.
And what are some of the complications?
Well, firstly, I go try to make somebody understand what are the symptoms the way they get. First, we don't contact this viral hepatitis. You know, we have what we call specific symptoms and non-specific symptoms. Like for example, fever. You know, mean say when you start to get fever, malaria itself they present with fever. Typhoid as well they present with fever. Other conditions that we get. But hepatitis itself can come with fever. We call it intermittent fever. This fever they go and come. You can treat if you say that okay between 1 to 4 weeks back. So you need to think more. Can I do my test? Let me check. And then another one, you get feeling, you don't feel well. Call a malaise on feeling not a good, feel good, not a feel well. These are like things so you see some people can begin signal. Maybe they feel so like I want sickle. When they take treatment, some people they do self-medication, treat themselves, but they resolve. Next, you get fatigue, tiredness. People are tired. Next, you know they will know waiting. But these are all like, if you look at them, they also common with other sick. Then with time, people like eyes they become yellow. Some man eyes they become yellow. But it don't mean say if you see somebody get yellow eyes, you will tell the person say that hepatitis you don't get. That's just one common. Then sometimes loss of appetite. We call anorexia. Some people don't feel for it. They lost appetite no more like that. So then symptoms here, it don't mean say if you experience them, like hepatitis you don't get to. But it's also symptoms which can associate them with hepatitis. So what you need to do, you need to see the medical doctor, you need to go to a health facility and start to do your test. That's why the world team say take actions, get tested. So we then later you get later symptoms where they come back as well. If then symptoms here they come up, sometimes malaria they treat you for, sometimes typhoid they treat you for, or you know do one day the test for hepatitis. Later, you can see some people belly the big. Ascites they happen. This big belly can be problem. I make not all big belly they think say na good living. The liver, the spleen, other organs in the inside the body where they enlarge as a result of insult or things that way don't happen. Then some people then urine color it can dark. You know, imagine if somebody they wets na dark rubber. I go know in urine color. So sometimes I can advise for they get transparent rubber. If I for that person they look in urine in color at times because the urine color self can dark. Sometimes the stool where person they go use the restroom, the stool, the pail. Normally you stool for smell. When you the toilet, for losing somebody in the toilet actually that's a good because something where they come out now the body where they mix with that feces. But if you see they smell and they all missing, nothing know they happen. That can be later stage there now. Until the person then sometimes the body they push quickly you don't wound, you know they able well. The finger, the nails them. A lot of signs and they way then clinical picture and they mostly now inside hospital and some of them patients and they can be under admission. So if then here they happen, their symptoms here they happen, nothing, and the signs and doctor don't confirm and say that they don't put you on treatment and you for adhere and comply for take them treatment and they know they take them. At the end of the day, how serious the complication is, like they affect you and then take you to death.
So this sick na sick with the men.
Yes.
Okay.
Na sick with the men. In we own Creole language, they say in the men. Some man can use the word cure.
Yeah.
Like based on research, if you check online because that information free, then go tell you say hepatitis C is curable because they don't they treat them now. Then even the hepatitis B, it's treatable. The earlier than diagnose them by you, it's treatable. But the message where people are not the past, they make some people in fear. See this sick one don't get them, a bad, you know the well, and not for interact with anybody again. No. If you meet the right healthcare worker, in fact, hepatitis is not all man the manager. Now infectious disease specialist. By right, so you don't do test. The first action where they take, as you listen to me, so when you hear you go do the test. When you go do the test, now 2 things they come out. You are either positive or you negative. So let's say your result shows say positive. Maybe na hepatitis B you go do test for. Then there are two what they call HBsAg, hepatitis B surface antigen. Now we go check for. If it shows say positive, they see two lines. They call it the test for malaria and hormonal strip. Then you the person, where that person do that test to, it don't mean say for begin give that person treatment immediately. No. After that first test day, all that test then they will the person for do now. Refer them. They will go do in hematology test, they know they will do in profile because the hepatitis B profile, they tell we whether this sequel you get, if you don't active, you transfer. Or whether it active, because hepatitis self will go to call chronic the viral hepatitis divided into two subtypes. You get acute viral hepatitis, you get chronic viral hepatitis. So the acute viral hepatitis less than 6 months. Maybe less than 6 months you get them. Some of them can resolve, like hepatitis A, it will resolve for itself back. Then hepatitis B, some studies they should say it can resolve. You don't go to that chronic stage.
That means say they well.
Yeah, they well. Then you get the chronic stage. Now that chronic, that means more than 6 months. You dey test the virus still dey persist, then they check for other parameters and they send you in a lab, then see say other things then they show, then tell we say you chronic. And you can be chronic, you be active carrier.
So after 6 months, wait, don't come in contact with
The
this
virus. Yes, if you don't
chronic.
say don't pass 6 months, then we can say that na chronic stage. But then the health workers and they manage you in that case. Then everything they tell you because now as a country we don't make some progress, tell me the car will not get no guidelines. Now one of the good news we have to share with the public is that Sierra Leone now has hepatitis B and C treatment guidelines, which the Ministry of Health don't do, which are good things that one. And then they also don't get policy where they guide a roadmap don't they don't get strategic plan when for 2024 to 2030 inside and document here for the clinicians and the one within the hospital procedures then they wouldn't tell people and for do. But you self way sick when they present with symptoms. One of the things health illiteracy they affect you in this country. You know banker, you know marketer, you know person where they sell. Don't just go give your life to anybody. I think that salon will not get the culture before you go see a doctor. If I follow check this doctor, whose area we dey, whose area we because at the end of the day, it get for lead you to care. And for you label somebody say you get hepatitis B, it don't become chronic. It means a lot. You don't go meet me in a community pharmacy. You come for do rapid test. I do a test for you. The next point is that according to the training, then they refer you. Go see the specialist. Then they refer you for further test. But immediately you do the test, somebody pull medicine, they begin give you immediately, and some of them medication as well get side effects. And then side effects are some people are not able to stand them. So if you ask me for that, the viral day, the non-viral day, the viral now gets acute and chronic. And when they go chronic now they then complications and then problems and they come. Some of them now inside hospital they notice them now, not to host again the person in there because we get them body fluids here when they come up a person. The sweat, the tears, the snot, whatever they come on and mouth, the saliva. These are all things that people they tell we say somebody can get hepatitis from sweat. What thing we want to clarify to the public is that if somebody go do test for the first time, they say get hepatitis, it don't mean say in sweat at that time it go pass hepatitis to you. No.
Okay.
But maybe if you don't admit to the hospital, it don't need that chronic all in bodily fluids need for be treated well because we get infection prevention and control so that you the health worker self no go contact them from at all.
Okay, Joe, we can talk more on the how policy they get them and also waiting somebody for do for making no get them because we they see plenty people they sell medicine on our street and you don't make measure of now the way. For me, I think saying a cause for concern. I would come back to and just now make we go now and continue with make we go now at the Freetown International Conference Center and continue with the National Town Hall as this time round annual Felix Elba bring President Bio in updates on electricity and infrastructure. Make we watch this video and see what in President Bio give on electricity and infrastructure.
But bring the president closer to the people the Ministry of Information and Civic Education be organize one town hall meeting where even the president be described as fumble talk. Usa in a place for talk to. The president be talk on bokuting them where government don't do and waiting any plan for do. One thing where the president be talk about na electricity and how the body where government be set up for the run electricity business at the country they operate. President Bio say the thief where people a thief light, they ambog the work where EDSA they do. From From the people President Biobi Semweso say, Idia say they employ people with a pa yuki business. The president be encourage salon people for stop for the thief lights. From electricity, the president be talk on infrastructure, as he say, in government don't make more road and bridge them past any government.
Now me na the infrastructure president. In addition to being human capital, the number of bridges that we don't build from where we take over 60 years ago independence, no government not build that here. In terms of the length of the roads that we don't build, no other government not want to do it. And we still the bill, and I want to assure all the communities, including the Matru, Bo, Bendicha, to Baya Junction, and many other Pujahun, we will continue and we will finish them one day because we development partners then don't know say we suffer and what they do we build the roads there for connect communities there. In fact, because we don't do bridges then we say ferries that we don't do over 5 of them now, then they go on and maybe early next year we will finish them bridges then the World Bank. Compare included, Seno included, Wajibu, that bridge included, Kailan. We don't get 4 more. The World Bank don't say, you are serious, they don't give 4 more bridges then. So, and then bridge them in. Not to this, not to call vote for the table. The other one, they give call votes, they say, a bridge. And they talk about bridges, Robbery bridge to Nasia, man. The one where they use. Maybe I'm not broken, but I left on there. Down there, a museum piece. Nobody so, maybe one for surprise you now. When they say human capital, we will calculate everything we don't know because infrastructure is the backbone of sustainable development.
From infrastructure, the president will also address the issue about election, as he be tell salon people say the next election go only happen inside 2028. For Voices Online TV, Mina Arnold Felix Elba.
All right, welcome back from that report there. We dey come back na studio as today we dey talk about hepatitis, wetin dey cause am, una don't know, and how person dey get am. We can talk more of am, and also one very important one we get for do it all kind medicine where we dey take. All na one day we can discuss and now before a 1:30 where we go read text message as the people don dey show concern as they want for get more information on hepatitis. Well, we dey come back na studio and join John Lamin Smith, founder National Alliance Against Hepatitis Sierra Leone, and also member na the Ministry of Health Task Force. I dey come back to you, Lamin. Let me go back to the thing the way they cause hepatitis. One very important one we touch now, the way we get for with the medicine them. Salon now we don't see plenty medicine in the street every day. We they see market at them. They market different medicine and we just they buy and drink. Tell me more about this. I mean, in terms of one of the cause them where they lead to hepatitis.
Well, these are bad practices where they happen. Probably not only in Sierra Leone, in other countries as well, because of the porous borders where we get. Probably maybe people in the come with something from other side where not correct. We get a regulatory agency where in a pharmacy board of Sierra Leone where then they register all medicines where they come inside the country. And then they get community pharmacy outlet where they get license. When at the place where you forget you medicine. And when you go to them place here, ask for a pharmacist or a pharmacy technicians for let them show you. But if you decide about somebody come say they can market medicine, I just want to give people in this idea today. When I ask them for a license, when I ask them show the card of the place where they market for. If when I do that, they go definitely know say sometimes it's not correct at all. So some of them medicine, one example I go give paracetamol or acetaminophen. This is medicine where again how person for taker. Like per day, you know, for take more than 4 grams of paracetamol. It's like 1 day. But then you see somebody, people, we're going to call them OTC, medicine they buy over the counter. You enter on one side, you want to buy cold cap, you want to buy me grip, and you want to buy anti-cold. Some things also mix them for me. I get some cold, mix for me all the medicine. So get drug-induced hepatitis. So if you don't go buy cold cap, you don't buy relief, you don't buy the one and the, you begin to take two, they all get paracetamol inside. You don't take excess of the paracetamol. And when you look at the metabolism, the way paracetamol they break down the body, they nyaka instead they inflame the liver. So what one of the people understand, not only on the viral causes.
When you say inflame the liver, what do you mean?
Injury, it don't insult
the damage.
It don't disturb the liver. Okay. It don't cause pressure on the liver. At the end of the day, the liver not go doing work they do fine one. And if that's the case, maybe if we continue this practice as a country, because we safe civilians, if we then about to see somebody cow its medicine. We get away don't allow them. No, what about the bus driver them? And then they allow them. At the end of the day, they give small thing. But then look that small medicine they go buy 2 Leone or 3 Leone. At the end of the day, some people can stand for think over the years. Well, I don't know. Be this sick, I don't know how I get them. Because when you teach about the causes of hepatitis, you know, look at them here. Them medicine how people in the take buy medicine, non-prescription medicine, doctor not take for take medicine. Even the all them prescribed for you get limits. Not just for the taker. Now this country see some man and get a prescription where medicine done. In a go refill am for himself. You know they see Dr. Bako, let's talk to her whether he for take him back. But because he not understand or because he no one go there back, what do you do? So say they repeat am 2-3 times, they buy the medicine for himself. And when you go to one pharmacy, then tell and say, hey no, they go by other side. So these are all concerns, you understand? And then I want just dwell on the viral causes. We say too they do where they make you get the viral hepatitis B and C. Unprotected women that the business. Condom, they don't give condom for let people they use condom. But then when they see some man say condom, they make them say they not good. Some man they pull up. But what they try to tell you is that now the consequences. If you go get my man that the business with somebody, and some man go off where they do my man that the business. It's not something we need for fight. I mean, I tell somebody last time I say if you put 2 people you put with man where they do my man that the business and black man with. Sometimes we can just rough. Some man they go to the extent take medicine. What they take medicine for woman for? So in that case, that process, you go to them called blisters. I'm telling you that una wound yourself. If that one person infected, you don't know his status. You say if they get on it. So unprotected my man that the business, there is possibility. Sometimes after my man that the business, if I let somebody wake, not there for long, go rinse up yourself. But some man will take long sleep. So all these are practices the way go make sure say you contact something. Another way they get them people they tattoo them body now. You know side this practice they come out. See them boss here, Olia. Maybe then they go some south side they go for go do them piercing here. If you go some outside, maybe something like equipment they don't use for one person, they can use them pay you back. You get viral hepatitis. So that's not also concern. Then when they engage in kisses, these are the other concern. So man, before you engage in kiss, before you begin kiss on yourself, if you find let somebody get mouthwash, rinse your mouth, you take care of yourself. But you don't know whether the person gets suicide mouth or not. And if something they come out the person infected, you go get them. Then blood transfusion, the one who they go give blood. Before you go pass the blood to other person, they need for screening blood. If your blood not get no sickness, then go take and give that person. But if you not check, that's not problem. So the type of, even when you vaginate, you can't practice what they do, even then FGM, then bundu business, then thing, and anything that they use sharp object. I want to say barber shop, even barber shop where they go. Be very, very vigilant if you're a young man. Watch your open the blade before you. Check if you can get hygiene practices, because sometimes they don't like hepatitis B virus, it takes 7 days outside. When come inside back the body, you have to contact the membrane, so it's very active.
Wow.
You na come back, so say they go wash your pikin mouth na bathroom. To wash, you don't find for exchanger. No. Not take, because some way they watch him out, blood they come out. Sometimes people come up on that toothbrush, you take a left arm. Then later you take a can wash more to or something a couple say, no exchange. Then you get hepatitis from their side and they. So then causes here now therefore look at with practices. The men the way they get sex with them compliment them. Why? We they see that if you involved in that, there is tendency for like any type of sex. You get oral, vagina, and anal sex. Why you now the anal sex you dey practice? There are lots of sickness where they come up behind that. If you na oral sex you want to, they put your mouth down there. Make sure say you clean yourself up well. Make sure say the woman self, because I'm telling you, the practice the way we get now, we houses them. You go don't get money, you don't get picking, you don't get host. Later na sickness you dey spend money per go because you first half of life you be just dey do anything where you want to do without you know they take care. So then causes here, then come on. And people at the end of the day when they can go test, then tell them say they get hepatitis. So get this sick. You ask them, you know, there are multiple sexual partner, sexual workers, commercial sex workers now. If you they say they get this, if they get hepatitis, as long as you go with somebody when infected or if you're too infected, when I get my man daddy business, unprotected couples, no problem. It is time to get honest integrity discussion. If you the woman, you go do test, you happen for say positive, whether for HIV now or whether for hepatitis. Sometimes they can ask them a confidential issue. For tell you man, some can say no, not for tell her. And that's right. But imagine you infect another person. So this can be a concern. Then mama, when they go born picking, they call them vertical transmission. Sometimes they mama they pass on to him picking. And when you can pass on to that picking, there is a concern. Most of their times they can get all the symptoms and sign later. Now they could advocate to Papa government and they talk. For say we're going to call it hepatitis B back those vaccine. When they born picking within the first 24 hours. Yes, so most of them pregnant women or you young girl, the actions when the World Hepatitis Alliance or the World or the Universal, the Sustainable Development Goal, they try to talk about this. They say, let us take actions. And their action, yeah, someone you go learn everything, you go teach her everything, but it's still not they do the ideal practice them. It's still not they try for practicing well. So in them case, then it can be a problem. So let me know what we do. Let me take with time because the world say by 2030, we for eliminate viral hepatitis. Sierra Leone Saudi. We don't move. Government don't give you guidelines, you they manage them. Government don't give you policy. And also, these documents account, and this is a very grand way now healthcare worker, these documents, they need for no butter. This, if you look at them, the National Viral Hepatitis Strategic Plan 2024 to 2030, a lot of issues. They even show you the gaps within the country, how the government they try. So if we everybody sick, not to panic, cannot give one panic why they can't teach. We don't need for panic. This sick not from 1970. It don't they people are not they get them. Among homosexuals, and then they discover this sick. Among other blood transfusion, what they do. So the virus don't they live within the human population. So if we are to fight hepatitis, be it journalist, be it health worker, anywhere, let me know the documents already. It is beautifully written, but we need to implement what is in this document. But Sierra Leone will say we'll reduce 50% by 2030. So go know your status, family, call your partner, make them go test. If you're negative, again, the good news here is hepatitis B get vaccine. Vaccine is something where they give you, they protect you. But what I will say, some people, I don't know whether if in a poverty, then they sleep inside. But your health, it very matter. Some man when they call the vaccine for we free. Everything about hepatitis treatment and vaccination is not free. But as a government or as a Ministry of Health leadership, they know they try. Because even Peking during in time when they go for that Maclean, they get that pentavalent vaccine when they give. Then they protect the Peking at that stage. Then if you want to move another stage ahead, say, okay, now, not get the hepatitis B, back those vaccines. If you're an adult, you go test and say negative, you for take the 3 shots of the hepatitis B vaccine. Then after that again, for do the test, let me know if you don't get the soldier, man them. But some man will tell you, say, I don't get money, the vaccine expensive, let government make them free. But that even thing when they make them make free for you, now somebody they pay for it. So it is costly. All me they say is, let me try for do the best, let me understand what the sick, and then let me confront it. If we confront it, and then we do it best, then definitely trust me, hepatitis will be a thing of the past.
All right. So many messages they don't can answer with 034-225-373. Make I read some of them. No way before read all. This first one they say good afternoon. Voices Online TV, and thanks very much to the very outspoken and vibrant guest in the studio. My question is, how can I be treated without any stigma of hepatitis? It comes out from Kekura. This other one they say the truth is you guys are doing well, but all the medical people except for some few high-profile ones that are keeping such cases private. But most times, people shy away from hospitals because of stigma, and the stigma itself starts from the medical people. This other one, we don't come inside the program, they say, I want to salute you guys for holding such program. These are some of the programs you need to be having, because there are so many issues around hepatitis, especially the one that has to do with transmission, but people are shying away from the fact. This other one, they say, I am having continuous sweating, especially at night. I am contemplating if I am positive or negative. Please help me out. What can I do? I don't want to visit any hospital, especially the open ones. Okay. He will respond to him. This other one, we don't come inside the program, they say the vaccine is already here, but it's very expensive. This other one, we don't come inside the program, they say the issue of hepatitis is everywhere now in Sierra Leone. Before, it's very difficult to hear about hepatitis, but now everywhere you go, you will hear about hepatitis. What is going on in Sierra Leone? We need to push further to see how we can prevent some of those diseases or viruses from spreading in our beloved country. The last one, where don't come inside the program, they say, kudos to you guys, and I want to appreciate you all for doing great things. Please push further with this advocacy. It's very important for people to know their status for both hepatitis and HIV. I support the guy in the studio that we all need to push and see how we can get things done in Sierra Leone. I am Mohammed Dean, texting from London. Okay, thank you so much for your text. That's some of the text messages, the one we don't get to say.
Yeah, we say boku thank you to them for that. The first one, they talk about how they will treat them and stay away from stigma. Sometimes stigmatization begins with yourself.
Sure.
You cannot defeat yourself. I just want to let you know, say, any condition where they go through now, there is a solution. There is no problem that probably doesn't have a solution. Those that do not have a solution, you leave it with God Almighty to address that.
In fact,
one.
you don't even know if it's positive.
So, fine. So if you say stigma, it depends on what you disclose out. But I want to tell you, say, the issue of privacy and confidentiality there with the health workers then. Sometimes I get a lot of calls, people call me, discuss with me. I want to say beaucoup thank you to Dr. Suleiman Lako, who is a physician specialist. We refer Dr. Tijan, there are others, Dr. Edwin. There are others, doctor, we can refer you to. I agree. But I'm telling you, it will go out of them practice. If you go test somebody for hepatitis or HIV, you begin disclosing information. That's not the be at all. Whatever they try for, say, we have to educate the people made them know. So you cannot stigma yourself. Sometimes we have misconception. People then they get some idea, no, this sick I get now, which I get. Then some man they get sick, they cast out prayers. Even when they see now we hospital settings and now, people then they go, the people then don't sick. When a science for take rule over, then they go for prayers. This sick, you not go be this sick, you not go that. Yes, that prayer is good. But what I'm telling you, if that sick is inside there, it is progressing. That's not the stop them. At the end of the day, the complication, how that they suffer. Now you. So stigmatization is something where the government they fight against tigi one, and you self, you secret now, you secret. Follow the treatment. So man they hide. There are other countries where woman then before you get that to them, they tell you say me are HIV positive for protect another person. But yeah, they see somebody get sick, you want to spread them to all man. Those are things we not fine at all. The other text I talk about transmission fact. Of course, science is fact. We don't tell you the means the way you get them. Now you just know how it will take you time. They don't give you condom. If you use condom, maybe you go reduce, maybe you not go get them. But if you say no, then later you can't get consequences out of it. What you go do? Then the other one they talk about continuous sweating. Say, what can I do? And just the advice, and firstly, don't practice the culture of visiting our medical doctors. I have a lot of friends. As a pharmacist, hospital pharmacist for Oladu in Children's Hospital, I have a lot of people that calls me. Discuss with somebody. How you go see somebody they pass now to PA system? Tell you say this medicine will take they mend this, they mend that. Then you buy it instantly. Why? So if you learn, you know, possibly get small understanding, see your GP. see your personal doctor, see your personal pharmacy, call somebody, nurse, then they give counseling to people. Talk to them and go guide you. But if you don't decide for telling, now some man they go online. He check treatment of this, he see some medicine. Before that, he order online direct for buy them. No, wait till them prescribe them for you. If they not prescribe the medicine for you, not take them. Because at the end of the day, you take medicine, you're not supposed to take kind of poison. Now the dose, now they tell you say you take them correctly. But when they see people, trust me, Sierra Leone will be a better place if we're ready for land. So many health programs and they don't across the country. So this other caller they tell me say he say everywhere hepatitis there, they talk about status. Yes, we talk of hepatitis, it's everywhere. As long as it is everywhere, that's why they say it is time for action. I don't know about hepatitis today. You don't ever do your test, know your status. At the end of the day, I will share a line. If somebody gets a further question for that, you can text me and send that message. And what can happen at the end of the day? That can be a very, very important one for see how we go able make sure say we fight hepatitis. But one thing I want to tell you, hepatitis B is treatable. Hepatitis C is curable. Check online. There are things that they tell you. Sometimes you can go to hepatitis test on site. Immediately, somebody begin to tell you, say, no, eat this food, no, eat that. Day. All you get people away for meet or for talk to you. What hepatitis in July 28th, it don't pass. But it don't mean saying that day no more for take action. That's why the ministry don't try for put document together. Even if they not get away for go per seminar or so. But the ministry, they work on action. Advocates. Make sure, say, we fight this thing as a nation. We don't fight sickness that we don't show very resilience. We don't fight Ebola. We don't fight Corona. Hepatitis, not that for say one thing we keep what they tell the people and talk about silent killer. It's a slowly and a silent killer disease. If you get it, you don't know. Some people don't get it, they don't know at all. At the end of the time when they know say they get the sick, trust me, the symptoms don't overcome them. Some don't in the hospital. Then some them cannot mismanage them. One of the problems we face in this country, particularly like Leone facility where they are doing. Why then they go with people and late? So they take the people and the picking and the sick, can them go on the other side first, go give them medicine. When water don't pass Gary now, they rush out and say, for come many people. At the end of the day, they lose them picking and their life. Then we make sure so we do it right. Then we make sure so we get culture for visits. Some man they go back in the hospital there. You don't get time for it. You go see people and they say sit down with. You get vex. Oh, can't see that long. You get for wait because any one person will go see the doctor. You get for inquire, ask some question before you say about because of that time. They imagine they tell you say you don't want to go to any hospital. If you not trust the medical professional, then a paper doctor you trust. Now they go kill you. Now quack people they trust. Now they go kill you. Now online you trust because some man they do online no more in order. This age of computer, we get for be careful. Even things some man they go YouTube other side, he just check. Then he apply the thing to himself without you not go through the medical people. At the end of the day, then complication and then side effect of anything the way you take. Trust me, it will end your life. So let me know what you're supposed to know. Let me do the test. Two things. You are either positive or negative. If you are negative, go for vaccine. For hepatitis A, no clean your environment. Dirty water business, no clean your environment. The culture of cleaning. But then people, it's way dirty any side. They say so then a compound some people every side. Then thing and then physics, then they figure all out. Then when they go to the bathroom, I want to say this clearly. They want to know the men, then long fingernails them. Then they cause danger to the health. Sometimes you left. Make sure say you don't get long nails. Because at the end of the day, you go to the bathroom, you don't go better water. Then at the end of the day, you carry this physics. By the time you make way, you don't come on this, so you don't go on the side. Someone don't even wash your hand for it. This is a problem. No land for the wash your hands. We know they carry the agent then at the end of the day, even fruits. Someone see cucumber, someone see lemon, you see apple, you see the right well, before you eat them. But you know they just take something more better. At the end of the day, hepatitis A can be outbreak, but it can be resolved. Vaccine, they give people them when they treat them. What the ministry say for a lot tell people them not to panic, not to secret and count. It don't they, but beaucoup people and they succumb to them. If you check statistics online, many people they will tell you thousands of people.
Now that we just want waiting at the status now for.
So the status for us for Sierra Leone generally, they tell about 13.8% of hepatitis B. That for every 7 people that we count, one person they get hepatitis. So these are concerned. Then they tell about 2.4%. But then studies done in 2022, and when you look at among the males, man and get it was 15.5%.
2022 and now 2024.
Fine. So more studies. The ministry try to put something together. Let them work together. So we do more studies for know the status. If you check globally, a lot today what they don't share. A lot of statistical data they don't tell you how many million people. Even the music we they play in the background, it's about 10 million people nearly infected. How many people get access to treatment?
And only few know say they get
few. So even the status in terms of access to treatment. Availability, affordability of the medicine. These are things we talk to as well. Don't want to count medicine, the pharmaceutical industry. If you count medicine when as a result of medicine, they can treat some chronic disease conditions, we'll be able to call GST free pharmaceutical. Men not tax them. Because at the end of the day, the price not go high. Because some medicine and price they up. Now they don't tell you say this sick now you get. Then they don't mark for you for go buy medicine. Then the medicine very expensive. It's a concern. Government they do invest. Government they try for do invest. But trust me, we as people, we sell for love yourself. Medicine is supposed for sell at a particular price. Not high you high so much that somebody they suffer. You know they get that consciousness and you say all thing they go up. You say they add you money. So these are things that we talk about. If we love yourself as Sierra Leoneans, let me make sure we treat yourself with integrity. Trust me.
So this particular alliance against hepatitis, waiting on a role more in terms of education, because the whole thing where they see us so get for do with more education for make people understand more waiting at hepatitis and how therefore prevent themselves from it.
Well, the National Alliance Against Hepatitis we don't establish from 2014.
Okay.
And being an alliance, so we get different sets of people. We get journalists, we get medical doctors, we get pharmacists, we get pharmacy technicians, we get nurses. Them we get different CHO, we get different people inside this alliance. One of the things that we would do as objective now for raise awareness. If you check on social media, just as the song where you play, people just show your face because some man is a bit beaucoup people them. You show your face. Tell somebody for be hepatitis, take action, go do your test. We don't do this. We read the first press release in a large all for hepatitis. A lot of people don't serve, but this all come up from one Ghanaian in a quick mensa. Himself is a pharmacist. There was a time when I was in college, that I was in third year because I did my dissertation as well in hepatitis. Tell me, say this is not concern. We try for begin put fact together, try for check around, we don't raise. So we roll with the advocates, with the engage. By that, the ministry, now we're part of the ministry get hepatitis task force now. Now that task force, they want put them in such a way, maybe we'll get as a unit or get hepatitis division. Now the Director for Disease Prevention and Control, Dr. Suleiman Lakodi, work with the leadership of the ministry for CC. Hepatitis can come with HIV program, even if it comes with HIV program. But let we see, let people get access. The medication, let it be available. You don't get it sick, then you want the medicine back, available. Then if it's available, let it be affordable, let it not be too costly. So the National Alliance Against Hepatitis have been doing, we go into communities, talk to people, but we serve the part of the public service now. This alliance will be just formed, put people together, let we get voice, we get a different executive where they want now, where they say, get for the can do the talk. But then a technical something where you call, say for let we come for carry the awareness and say, okay, for make a show up. No, see, we get different people that we can come and talk. We on target is, let me join on for make sure say we reduce hepatitis by 50% by 2030. Okay. This will reinforce advocacy, communication. They will let them strengthen the health system. Now somebody go tell me, say, are they offline? I go do test for hepatitis, then say I get out. What I for do? The personnel, let train medical people, let them know. Let people specialize. If people specialize will get them, then trust me, I sure say we'll be able to manage hepatitis. It will be a thing of the past in the country.
Okay, we come back to you, John, for make we can wrap up the program. Make we now take this last short message in the program this afternoon as we join Patrick Eugene Kashaw, where now one kush survivor, where they advise in company the way still they take kush or when a kush addicts them for make them stay away from kush. Make we listen to Patrick Eugene Kashaw as he send this message to accompany young people. The program we still they watch now Voices Online TV, where they come to you live now Voices Online TV Facebook page and YouTube channel. Now let me now listen to Patrick as he send this message to accompany kush addicts.
Me na Patrick Eugene Kashaw Elliott, where they live in 3 Street, Freetown. I be there into kush. I was addicted in it. I want to send a voice message to my company colleague them and the parents them say this not drug, yes, they addict to them, but you able to come out the back because we mindset clear, you able to come out the back. And parents them please not give up on your picking. Stand firm and stand that one. Tell you oja and tell you belt. For make sure say you picking will come out better one. We are the future leaders of tomorrow. Without us, there is no future leaders. Thank you.
All right, so one for say plenty thank you to Patrick for where he don't take in time and survive kush. We pray and hope that he no go again and it will continue for inspire more young people we still they into the habit. Not forget to still watch the program Lunchtime Live, where they come to you live now, Voices Online TV, now with Facebook and YouTube channel. We dey continue the program, and today we don't dey talk about hepatitis, how party they get them, waiting at the sick, and waiting at the status na salon. Now we can continue as we dey round up with prevention. Waiting is supposed for do for make you not get the sick. Well, I come back to my studio guest when John Lamin Smith, and in the founder National Alliance Against Hepatitis, and also member na the task force where the Ministry of Health been set up. Smith, let me continue with the program. Now we don't talk so many things about hepatitis, how possible they get waiting at the sick. Now, how somebody for prevent himself or waiting possible for do for make sure say you not get this particular sick.
Prevention na things that already happen at different levels. We get the primary level prevention, we have the secondary and the tertiary. Sometimes some other book talk about primordial mentions. So firstly, for to prevent hepatitis, we get to accept the message. You know, we get some people who know the acceptance is one strategy for prevention. Health worker then say, let we do this. When I accept them, when I implement them, it will save on a life, then fine. The next thing, don't look at the lifestyle. You know, God don't design we, don't give you fine life, but oh yeah, when they do things that will damage his life. How your life go then alcohol and your best friend. Rum now you let. When you look at the word rum, ruin useful men. So in that case, even though studies they tell you say recommended units there, but imagine you don't build your house, you don't get a beautiful wife, you don't get a picking them. At the end of the day, liver can get problem. Reduce that alcohol consumption, or if possible, avoid them. Medicine them. Then mix medicine they wouldn't give you until you sick, you get pussy upline, bang bang medicine there. Of course, this not sauce so. Now sauce they already pull medicine they already give you so they English medicine there. But the point here is you don't know the dose. You just they swell and normal, you just they drink. So taking a possible they look for opportunities. Somebody tell you say drink this medicine. But woman they don't pack the liver. As a result, already go give them medicine, maybe in the name of say, I want born, I want do this. Not take them traditional medicine and that's the prevention. Because when they talk about waiting, they insult the liver. Then we know waiting at the thing they will not go do for insult the liver. Then let me not buy medicine at street. And they beg you. As a pharmacist, I know the implication. I know waiting don't they happen people them. You go buy what they do with best to. But then they arrest them and the old people them. I don't see one situation where somebody then at the boss they tell the person for stop. Then the public and they say, left hand, they defend in living. Let's sell. So even you wouldn't come for camp protect. They go against that person. How will do that? So medicine na street, make you not buy them. The best you can do, not put the money for buy them. When you not buy, let that person in waka waka. Then now do community enforcement. You see somebody can put PA system like community, put medicine, begin the Allah. You not go on out time. Tell the person say pull an eye. It can be a good measure.
But how the community and other people go able for do this if they don't know the precaution or the danger of waiting and they accept?
It's simple now. They tell you so now. Community protection, safeguarding. This thing they cause harm. Buy medicine and street not good to people. 10 people and then Sierra Leone and some of them they do. Some of them probably on the other side they come on. When we see them, some of them they educate them. Stop this, not a good practice. Some don't even know what they sell. Some man they sell medicine different. Look at case we get now Waterloo, where somebody they go take medicine them, it give them different name them. Medicine so for treat HIV, it go label them for treat malaria. How can you do that? How can you do that as a nation? It's a problem. You are killing people slowly. So these people when they look for any sort of business. The cool substance, anything they talk about, the effect they get. When they see people they get so food now, the problem and but when people they stop for take, people they stop for seller. So the best thing, community, watchdog, let me watch yourself. No, not do this. Then the sex lifestyle are the big. Who don't get money, who don't enjoy yourself. The best thing, the type of sex lifestyle, let we know. If you're not commercial sex workers or you they outside on the street, make use of condom, please, at the big. Because at the end of the day, you go contact sick. When they can't show up by you, it's a problem. Then we know the type of sex that we do. Then we body them. Your body is too nice for letting mark at all time. I don't know where they mark out there you impress. Why they tattoo? Then practice here. Why they boss your body? At the end of the day, it gets an impact. Even women know they put here in. You go for no who side they go boss if yes for the first time. Because sometimes Sunday, you get needle where you don't keep or you get pin where you don't keep. Then they go take it chucky picking in is. Then some people sometimes something fashion and they teach someone a sharp thing they go take. To speak in a user, you go take me, begin to go choking gum. Sometimes I tell person, there is some blade. You see, there's some blade stamp somebody don't use her. Who get them but this blade? Give me by one cut something. They left the cut, it cut itself. These are all problems. Then you are a health worker. we dey give injection, you dey treat people them. You pierce yourself, reports for prophylaxis. Then we all know them here, and then we stand for listening to wetin dey inside documents. You know, sometimes the culture will not dey read. All them preventive measures, then they don't put them. Then the vaccine, you test you negative, come out and take the vaccine. This is the only way we go increase coverage, and then at the end of the day we go fight hepatitis. If you go test for hepatitis now, then tell you say you negative. You know what I mean? It tell you say you're susceptible for getting sick at any time. So the best way they do, start for take the shot. As a family, una sit down. Spend the money on your health. It's better than spend the money on things that will kill you when not fine. So all them prevention mention here, then we take. And then to the government, we dey beg them. What thing government need for do? We go make sure say hepatitis will prevent in the country. Let government put that in place. Then what you need for do as health worker? For them present hepatitis. Now for do one, sometimes we get them philanthropists them. Try for see, you can do a community help. Then you can do screening. We dey do that. We don't go to a Badin community, other community, and we don't do screening. At the end of the day, some people could tell you, say, we provide free vaccine for them. So we talk to people, and then we make sure, say, we protect yourself, then we check your lifestyle, then we read and understand. If we don't understand about the things that we do around, we trust me, we don't go as a nation. Then we understand ourselves, then we know the practice that they do. If we do that, trust me, not to July 28th, no more, they can't talk about here. Then we can now tell you and say, we don't reduce this to this. Now imagine 13.8% of people having hepatitis B. When you count 7 people and say 1 person they will get hepatitis B. How? It's a good news. So let me try, let me make sure. So then preventive measures, and then from you personally, and to the way they deal with, and to the equipment, in a baba, make sure say you get hygiene at your barber shop. Make sure say you clean your barber shop. Make sure say anything that the way they use fine. I don't know, some man can use some sponge in barber shop. So even them pass and pay the smell. Change them, tell them, let them clean all them things. Then if they do them, it go well. The one that they do men at the business, and they our advice not to fet. Una not go fet on yourself, not to kill una, they go kill yourself. Una they go for go exchange, for be productive at the end of the day. Sometimes maybe if you God bless una get picky, not to for go kill yourself. Una do it nicely, quietly, so at least una not get blister at the end of the day. Una transmit infections and we not go find at all.
Okay, so for belle woman, waiting for do for preventing,
well,
for prevent in picking.
Well, basically they can go antenatal visits. Let them visit the hospital. When they do the antenatal visits there, they can check them. If they get infection, then they treat them. If anybody deserves something, then when they born them picking, that hepatitis B back those vaccine. Would they advocate for them? If the government puts and just inside the vaccine schedule, then definitely they born picking within 24 hours. Then go get on that hepatitis B back those vaccine.
All right, one for say plenty thank you for where you take it and join me at the program this afternoon. We say plenty thank you to all the one that we don't watch we live now Facebook and we YouTube channel. And today we been talk about hepatitis, waiting at hepatitis, how somebody they get the status na salon, and also how you for prevent yourself from And we don't hear from John Lamin Smith, where in the founder for National Alliance Against Hepatitis, we don't can tell you about this sick, and we don't hear where he say out of 7 person a salon, now 1 person, possibly 1 person gets the sick, and this will also get for do with so many things. Them. So if you want for know his status, now for go now hospital, made and test you for hepatitis. If you positive, you go able for get treatment. If you negative, then go able for advise you as to waiting for do. Well, if you want get more information, this na the number where you for reach out to so that you will able for save yourself. The number na 077 820 The number again na 077 820 Now the number na the way you for call or drop message to if you want to get more information about hepatitis. Well, we say plenty thank you to the entire production team we put this program together. Mohamed Denke, Ralph, and Ali Mami, and also to the producer when Arnold Felix Elba. So till tomorrow we another edition of the program Lunchtime Live on Voices Online TV, Facebook page and YouTube channel. Mina Fatima say where they say tata and get yourself a wonderful week.
Be hepatitis aware, know it, confront it, protect yourself. Be hepatitis hepatitis are we are, know it, confront, protect yourself. We are here to raise awareness about hepatitis, 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 hepatitis in our country. World Health Organization is saying, be aware. Ministry of Health and Sanitation is saying, be aware. National Hepatitis Alliance is saying, be aware. Pharmaceutical societies alone is saying, be aware. Pharmacy Board of Sierra Leone is saying, be aware. Parliamentary Health Oversight Committee is saying, be aware. Sierra Leone Medical Dental Association is saying, be aware. Naps and Slims of Sierra Leone, they are saying, be aware. Sierra Liver Foundation is saying, be aware.
Don't be panic. Be hepatitis aware. Be hepatitis aware. Be hepatitis aware. Every year, July 28th is World Hepatitis Day. We must be aware because hepatitis is a slowly and silent killer disease. It affects everyone at any time. 10 million people are nearly infected. 95% of people having it unaware. Less than 1% have access to treatment. Why? Oh my people.
Know it, confront, protect yourself. Be hepatitis aware, know it, confront, protect yourself. Hepatitis aware, know it, confront, protect yourself. Be hepatitis aware, know it, confront, protect yourself.